If you've had a hearing test done and you've been, told or recommended hearing aids, the first thing we'll do is first engage on how you feel about hearing aids, because it's not something that everyone is open to. So that's the first step. The benefits do override the limitations. It does take time. It's not a miracle. So if you wear hearing aids, it's not something you put them in and then great, you can hear. But what you'll find is that it does make life a little bit more easier. First, we would do a demo for you to have an idea of what the hearing aids feel like in the ear, and we show you what the hearing aid or the hearing aid that's suitable for your hearing loss, and then give you an idea of what the amplification sound will sound like that is programmed to your hearing loss. So you might feel like, I don't want to wear a hearing aid, and I know there are some sort of stigma attached around wearing a hearing aid. But once you start wearing the hearing aid, you realise how much it helps in terms of getting you back into your own social circle, and just gives you back the quality of life.
Ultimately, if we don't act upon hearing loss, we will find that even when we do use a hearing aid, we'll find it less easy to adapt to them and less effective in time, while as adapting earlier is seen to have positive implications on our mental well-being, our overall well-being, and certainly the auditory pathways as well. We're more aware over the last decade that the sensory input from ears is really crucial in maintaining those pathways. You won't optimize your hearing through even augmentation if you wait too long.
These are kind of like different hearing aids that we have. They're all from different manufacturers, so it all depends on the type of hearing loss that you have, and what you like in terms of the look of it as well. So that's why we offer a few different types. Every hearing aid has different ways of how they process sound. So one person might like the sound of one hearing aid than the other. They're very discreet now, very, very chic and elegant. So this is like one type that we have. So this part will go into the ear. So we go like that. And then this piece will sit behind the ear. So then you can see that from the front, the wire is so thin, you're less likely to see it, that you're wearing a hearing aid. It just looks like the back of your glasses rather than a hearing aid. Okay, so these are a few different types of hearing aids that we do. So you've got ones that go behind the ear, which looks like this. And you've got ones that go in the ear as well. These are dummies, okay? And they come in different sizes. So that's the smallest we do. That's one of the biggest ones, and that's the medium size. So these are custom made. So these go in the ear, and these are ones that go behind your ear. And if I just swivel you around a little bit. So I'm going to switch the hearing aids on now. Okay, and I'm going to talk to you exactly the same as how I was. So that's the hearing aid switched on. Okay, how does my voice sound to you if I keep talking to you like this?
Much clearer. My voice in talking to you sounds a little harsh.
Yeah.
Yours doesn't sound harsh. Yours is much, much clearer.
Yeah. Does it feel like I'm shouting at you, or does it feel normal?
No, you're not shouting.
Yeah, I'm not shouting at you. My voice is still very normal conversational level, and this is what it sounds like with amplified sound. So you can see the difference it makes. You're not having to strain as much to hear.
You switched them off?
Yeah. Did you notice the difference?
Oh, enormous difference.
Yeah. When you start wearing hearing aids, it is a trial and error. So you won't know what works for you and what situations it's helping you in without you actually going ahead and trying the hearing aids. So once you start trying the hearing aids, that's when you're able to give me a bit more feedback of where it's working, what's not working, and then we can try and make adjustments to make sure that you are able to wear the hearing aids and comfortable with them. And also it's just any adjustments if you feel that the hearing aids are not working for you at the moment, or you need any kind of like adjustments or controls on the hearing aids, then we can also look into that, because the aim is to try and give you a better quality of life. Or if it's being able to hear your grandkids, or if it's being able to hear the birds singing, whichever scenario means a lot to you, it's slowly working on those issues rather than everything as a whole. Then all you have to do is just come in, and then we'll try and troubleshoot together and see how we can make the hearing aids work for you.